Pandemija španske groznice pre 100 godina uzela je ogroman danak. Procene su i više od 50 miliona ljudi je preminulo tokom 3 talasa opasnog gripa. Današnja pandemija Covid-19 srećom manje je smrtonosna, ali i 100 godina kasnije svet čini slične greške. O poukama Velike groznice i pre svega poukama koje nismo izvukli razgovaram sa Džonom Berijem, istoričarem i autorom svetskog poznatog bestselera Velika, influenca. Mr. Beri, thank you very much for joining me tonight at N1 TV.
Thanks for inviting me on.
Yeah. First of all, I would like to ask you, is it possible to see some patterns repeating after 100 years?
I'm sorry, I didn't hear you.
I said, is it possible today to see some patterns that they are repeating? Can we draw some lines? Yeah.
Too much so, I think. The biggest lesson from 1918 was to tell the truth, that people in authority could save lives if they simply told the truth. And in too many countries around the world, that's not happening, including, unfortunately, the United States. There are countries where the leadership has been candid, and they have done much better.
Well, you said that 100 years ago, and you wrote that in your book, there was also an information issue. Could you explain a little bit what happened then?
Well, the motivation was different back then. Of course, much of the world was at war, almost all of Europe. Spain was not at war. Switzerland was not at war. But the countries at war were controlling the press, and because there was concern that any negative news would hurt the war effort, those countries made sure that the media did not tell the truth, that they printed largely what the government wanted them to print. And this meant initially that people were not protecting themselves when they might have been, that the virus spread more widely than it might otherwise have spread. And the result, of course, was that people were dying. Another lesson from 1918, which was incorporated into the pandemic preparedness plans for the United States and many other countries, was that what we now call social distancing and masks and things like that actually had some impact on the spread of the disease. Again, some countries around the world took that lesson to heart and proved that that lesson was correct and have done really amazingly well in containing the virus, and other countries have not. It shows you how important individual leadership is. It also shows you that just having a plan, no matter how good it is, doesn't do you a lot of good unless you were going to execute that plan.
In your book, you explained very well the situation in San Francisco back in 1918, when the whole issue was well communicated and there was a trust between the authorities and the people, and it helped.
It did. It contained the panic. There was reason to be fearful in 1918. That virus was much more dangerous than the virus we're facing today. In addition, it killed people who were young and healthy. In fact, most of the deaths, probably 2/3 of the deaths, were people between 18 and 45. But while most of the United States and most of the world at war was downplaying the dangers of the virus, in San Francisco, the mayor and the local business leaders, trade union leaders, the medical community, and issued a joint statement that said, "Wear a mask and save your life," in huge print, huge type on a full page of the newspapers to get across the danger. And in fact, San Francisco, I think because of that approach, functioned much better than many other cities. For example, in Philadelphia, which was one of the cities where the media continued to lie to the public. In Philadelphia, when they were calling for volunteers day after day, begging people to come volunteer, people were actually starving to death because everyone was afraid to even feed people where everyone was sick in the home and couldn't even feed themselves. But in San Francisco, when they asked for volunteers, they closed schools, for example, and teachers volunteered as everything from telephone operators to ambulance drivers. Obviously, if you're driving an ambulance, you're putting your life at risk. And yet people in San Francisco, the community came together. I think that was largely, again, because of the way the leadership of that community approached the disease. I live in New Orleans, where, of course, Hurricane Katrina struck 15 years ago. In most disasters in New Orleans during Katrina, the community came together. People were helping each other. And that often occurs in disasters when there's good leadership.
So what would you say, I'm sorry to interrupt, what would you say, how dangerous is to trivialize the news or to make the fake news? So we can now come back to the COVID-19 crisis. So even in today, we have so many stories that the authorities are either denying or trivializing the news.
Well, I think it's very dangerous. This virus, again, it's not as lethal as 1918, thank God. 1918 killed 50 to 100 million people in a world much smaller than today's. If you adjust for population, that would be 220 to 440 million people today. We're not facing anything like that, but this disease is dangerous enough. It could certainly kill easily in the tens of millions. If we are not careful. The most frustrating part of the whole thing is that we have demonstrated that we can control the disease through public health measures if people will implement them and follow the guidelines. So, I mean, for me to watch these things not happen and watch people die when they should be able to survive, it's tremendously painful.
You mentioned Philadelphia. Philadelphia made, according to your book, so many major mistakes back in 1918. One of them was a massive gathering. Coming back to today's times, we also have, during the COVID crisis, we have some massive gatherings. I will tell you, in the region of Western Balkans, in Serbia, for example, we had soccer matches a month ago play with the audience on the stadiums. Here in Serbia and in neighboring Croatia, we have the elections with huge celebrations and the big rallies before the election and the celebration afterwards. Could you explain a little bit about through the Philadelphia case? What are the dangers? What are the things that we didn't learn about the massive gatherings during the pandemic?
Well, outside is a lot better than inside if people are not pressed close together. They're not shouting, singing, and things like that. But in Philadelphia, the virus had already arrived in the city. The medical community begged the city's leadership, the public health commissioner, to cancel a huge parade. And a parade is one of those places where everybody really crowds close to the street to get a better view. There was singing, which was standard behavior as the parade went by. It was a Liberty Loan parade to raise money for the war. But Philadelphia at that time was one of the most corrupt cities in the United States. The mayor was actually indicted in the middle of the pandemic, not for some trivial stealing money, but as an accessory to murder, pretty serious charge. And the public health commissioner didn't have any backbone. And as a result, the parade went forward. There were several 100,000 people gathered, again, pressed very close together, singing. And the incubation period for influenza is 1 to 4 days, and like clockwork, very predictable. A couple of days later, influenza exploded in the city. It was on a per capita basis one of the hardest hit cities in the United States. In fact, absolute basis, it was then the third largest city in the United States. Many people died who might otherwise have survived directly because of failed public policy.
Even back then, in some cases, even today, we have some inconsistency between the politicians and what the authority says and what the expert says. What could be the consequences if the authorities doesn't hear what the expert says?
Well, the irony is that most of the politicians who are downplaying the disease are doing so because they want the economy stronger, because they think it hurts them if it's not. But the way to get a stronger economy is to control the virus. It's not an either-or thing. You control the virus and the economy is stronger. In fact, there were studies in 1918, recent studies by Federal Reserve banks in the United States of cities in the U.S. that had closing orders for a longer period of time, and they discovered that those cities economically did a lot better in the months in 18 months to 2 years after the pandemic than those cities that were closed for a shorter period of time. You need confidence of people going into a business that they're not going to get sick. You need staff that's not going to be out sick or taking care of somebody who's sick. It is a difficult thing to pay the price over a shorter period of time. It's intense, but over a longer time, it pays off, both in terms of economics and in terms of people's lives not being lost.
What would you say are the greatest dangers if some countries or regions or cities are reopened too quick? And is it possible to introduce the second lockdown?
Well, politically, it's difficult to close down a second time after you reopen. Back in 1918, a lot of cities reopened too soon. The pandemic came back. They closed down a second time. There was a lot of resistance. A couple of cities, they had to do that 3 times. Each time there was greater resistance. Right now in the United States, we never really got a handle on the virus in the beginning. And Europe, as a general rule, Europe closed down, and as a general rule in most countries in Europe, they really tamped the virus down before they did anything. And in Italy right now, there are 3 cases per million. That's not the case in the United States, where, and also in a few other countries, where we didn't really close things down enough to get ahead of the virus. We reopened way too soon in many parts of the United States. And we're seeing spikes now that are worse than anything we saw back in March when we had to close down. Some states are backtracking. Texas has a Republican governor who's very much a Trump supporter. He was forced to issue some closing orders, limited, and to demand that masks be worn statewide. Politically, that was an amazing turnaround, 180 degrees opposite, but he recognized it was the only way to gain some control. The real concern right now is that there are so many cases, not only in Texas, but even more maybe in Florida and in Arizona on a per capita basis, that the virus will be out of control in those areas. And then as people travel and move around the country, they may bring it back to places that perform better initially, such as the Northeast of the United States, New York City, Massachusetts, and so forth, where they were very hard hit early. and they did close down. They have gotten well ahead of the virus now, but the concern is that people moving there or traveling for vacation from Texas, Florida, Arizona, and so forth might bring the virus back and lead to other spikes around the country where they have gotten control. We did a very, very poor job in the United States initially. Most of Europe did a much, much better job.
After the 1980 crisis, we saw the world change. A lot of changes we saw. So now I'm going to ask you, not as a historian, but as a futurist, what do you think the world will be after the COVID-19 crisis?
Well, as you said, I'm not a futurist, and it really depends on how soon and how effective a vaccine is. If we get a vaccine in 6, 7, 8 months, which I don't think we can that soon, we can have the vaccine, but to manufacture billions of doses in that length of time, I don't think is realistic. But if we get a very effective vaccine, in less than a year and manage to administer it, I think life will probably go back to normal. Very close to what we experienced before. But if the vaccine is not, this virus is not going away. This virus is going to be here essentially forever. It's a new human disease. If the vaccine takes a longer time, significantly longer, then you're going to see fairly dramatic changes in work habits and doing things like using Skype, Zoom, other communications media. There'll be a lot less travel. I think probably a lot more people will be working from home. Handshakes are going out the window. That may happen anyway. It could affect architecture, how people build buildings. Ventilation is very important in this disease. Many modern buildings don't allow you to open the windows for energy efficiency purposes. I think that'll change back. But it's all dependent on a vaccine. There's also the possibility that natural immunity will kick in and turn this virus into essentially like other coronaviruses that cause the common cold. It's conceivable that as our immune systems become more used to this, the second or third time around, that they may be able to contain the virus so it's not dangerous. But that's highly speculative on my part. We don't really know. There's no real evidence of that. It's a possibility.
And the last question, I'd like to sum up this interview. You very often quote Hegel when he says that if you learn something from history, that nothing is learned from history. What would you say that we are now doing as a major mistakes comparing the 1980 crisis and today's COVID-19 crisis? What are the things that we are repeating? What are the lessons that we actually didn't learn?
Well, we've already talked about it, and it varies, again, from country to country. And the number one thing, what we started talking about, was people in authority need to tell the truth. That helps society continue to function as close to normal as it can, and it saves lives. And some places learn that very well and have done pretty well in containing the virus and living as close to normal as they had before the virus surfaced. And some countries have not done so well.
Mr. Beri, thank you very much for joining me tonight talking to N1 TV. Hvala i vama, dragi gledalci. Ostanite uz program N1.